If you don't masturbate in old age, this will happen to you. Hey everyone, and welcome back to the channel. I'm so glad you're here today because we're diving into a topic that literally millions of older adults are dealing with, but almost nobody talks about openly. And before we get started, I want you to do me a favor. Drop a comment below and let me know where you're watching from. I love connecting with viewers from all around the world, and it really helps me understand who's in our amazing community. Now, if you're someone who values honest, science-based health information that could genuinely improve your quality of life, make sure to hit that subscribe button and ring the notification bell. Trust me, you don't want to miss the content we have coming up, especially if you're interested in aging gracefully and maintaining your health in ways that most doctors never discuss with their patients. Today we're talking about something that affects nearly every person as they age, yet it's surrounded by so much shame and misinformation that people suffer in silence. I'm talking about sexual health in older adults, and specifically what happens when you completely stop engaging in sexual activity, including masturbation, as you get older. Now, before anyone clicks away thinking this is too uncomfortable or inappropriate, let me tell you something. I've spoken with countless urologists, geriatricians, and sexual health specialists, and they all say the same thing. This is one of the most important aspects of healthy aging that nobody talks about. The medical community has decades of research showing that sexual activity, including solo sexual activity, plays a crucial role in maintaining physical and mental health as we age. So let's start with the basics. What actually happens to your body when you completely stop all forms of sexual activity as you get older? The first thing you need to understand is that your body operates on a use it or lose it principle in many areas, and sexual function is absolutely one of them. For men, when you stop having regular erections, whether through partnered sex or masturbation, several concerning things begin to happen. The smooth muscle tissue in the penis starts to lose its elasticity. Think about it like this. If you had your arm in a cast for months, the muscles would weaken and lose flexibility, right? The same principle applies to the erectile tissue in the penis. Regular erections help maintain healthy blood flow and tissue elasticity. But here's where it gets really interesting, and this is something that surprised even me when I first learned about it from a urologist colleague. When men don't have regular erections, the penis can actually begin to shorten and lose girth over time. This isn't just a temporary thing, it can become permanent. The technical term is penile atrophy, and it's more common than you might think, especially in older men who've completely stopped all sexual activity. Now, for women and ladies, please don't think this doesn't apply to you, because it absolutely does. When you stop having regular sexual activity, including masturbation, the vaginal tissues begin to change dramatically. The vaginal walls become thinner, less elastic, and produce less natural lubrication. This condition is called vaginal atrophy, and it can make any future sexual activity extremely uncomfortable or even painful. But the physical changes are just the beginning. Let's talk about what happens to your hormones. Sexual activity, including masturbation, actually helps regulate several important hormones in your body. When you climax, your body releases a cocktail of beneficial chemicals, including oxytocin, dopamine, and endorphins. These aren't just feel-good chemicals, they play crucial roles in maintaining your overall health. Oxytocin, often called the bonding hormone, helps reduce stress and can even help lower blood pressure. Dopamine is essential for motivation and feeling pleasure in everyday activities. Endorphins are your body's natural pain relievers. When you stop having regular sexual activity, you're essentially cutting off a natural source of these beneficial chemicals. And here's something that might shock you. Regular sexual activity, including masturbation, has been shown to boost immune function. There's actual research showing that people who have regular sexual activity have higher levels of immunoglobulin A, which is an antibody that helps fight off infections. So when older adults completely stop all sexual activity, they might actually be making themselves more susceptible to getting sick. Now, I can already hear some of you thinking, but I'm older now, isn't it normal to just lose interest in sex? And yes, it's absolutely normal for sexual desire to change as we age. Hormones naturally decline, medications can affect libido, and health conditions can impact sexual function. But here's the key point that many people miss. Even if your desire isn't what it used to be, maintaining some level of sexual activity, even if it's just occasional masturbation, can have significant health benefits. Let's talk about the psychological effects, because this is huge. Sexual activity releases stress-reducing hormones and can improve mood. When older adults completely stop all sexual activity, they often report increased feelings of depression, anxiety, and general dissatisfaction with life. There's even research suggesting that regular sexual activity can help maintain cognitive function as we age. One urologist I spoke with told me about a patient who was in his 70s and had completely stopped all sexual activity after his wife passed away several years earlier. He came in complaining of erectile dysfunction, but when they talked more deeply, it became clear that he hadn't had an erection in over 2 years. The doctor explained that his erectile tissue had essentially become dormant, and it would take time and effort to restore function. But the good news was that it was possible with the right approach. This brings me to an important point. If you're someone who has stopped sexual activity due to loss of a partner, medical issues, or just general disinterest, it's not too late to make changes, but you need to understand that getting back into it might require patience and potentially some medical support. For men, this might mean working with a urologist to address erectile dysfunction. There are many effective treatments available today, from medications to devices to lifestyle changes. The key is not to accept dysfunction as inevitable just because you're older. For women, it might mean working with a gynecologist who specializes in sexual health for older adults. There are treatments for vaginal atrophy, including hormonal and non-hormonal options. Again, the key is not accepting discomfort or dysfunction as just part of aging. Now let's address the elephant in the room. Masturbation specifically. I know this makes some people uncomfortable, but from a purely medical standpoint, masturbation is a normal, healthy sexual activity at any age. For older adults, it can be particularly beneficial because it doesn't require a partner, can be done at your own pace, and allows you to maintain sexual function on your own terms. For men, regular masturbation helps maintain erectile function, can help with prostate health, and provides all those beneficial hormonal releases we talked about. For women, it helps maintain vaginal health, can reduce the risk of urinary tract infections, and also provides those important hormonal benefits. But here's something really important. If you've been inactive sexually for a long time, you might need to start slowly and be patient with yourself. Your body might need time to remember how to respond. Don't get discouraged if things don't work the way they used to right away. I also want to address some common myths that prevent older adults from maintaining sexual activity. First, the myth that older adults don't or shouldn't want sex. This is completely false. While desire might change with age, many older adults continue to have fulfilling sex lives well into their 80s and beyond. Second, the myth that sexual problems are just a normal part of aging that can't be treated. This is also false. While some changes are normal, many sexual problems in older adults can be effectively treated with the right medical support. Third, the myth that masturbation is somehow harmful or shameful. From a medical standpoint, masturbation is a normal sexual activity that can have health benefits at any age. The shame around it is cultural, not medical. Now let me share something that might surprise you. Several studies have shown that older adults who maintain regular sexual activity, including masturbation, actually live longer on average than those who don't. The reasons for this aren't entirely clear, but it's likely related to the stress-reducing effects, the cardiovascular benefits of sexual activity, and the overall improvement in quality of life. Speaking of cardiovascular benefits, sexual activity is actually a form of physical exercise. It increases heart rate, improves circulation, and can even help maintain flexibility and muscle tone. For older adults who might be less physically active overall, sexual activity can be an important source of physical exercise. But what if you're dealing with medical conditions that make sexual activity difficult? This is where working with healthcare providers who understand sexual health in older adults becomes crucial. Many conditions that affect sexual function can be managed or treated. High blood pressure, diabetes, arthritis, heart disease, all of these can impact sexual function, but they don't have to end your sex life. Medications are another big factor. Many medications commonly prescribed to older adults can affect sexual function. Antidepressants, blood pressure medications, and many others can reduce libido or cause sexual dysfunction. But often there are alternative medications or strategies that can help minimize these effects. The key is communication. You need to be honest with your healthcare providers about sexual concerns. I know it can be embarrassing, but remember that these are medical professionals who've heard it all before. They want to help you maintain the best possible quality of life, and that includes sexual health. Let me share a story that really illustrates this point. A urologist told me about a couple in their 80s who came to see him because they were having sexual difficulties. They'd been married for over 50 years and didn't want to give up their intimate relationship. With some medical support and lifestyle changes, they were able to maintain a satisfying sex life. The urologist said it was one of the most rewarding cases of his career because he could see how much it meant to their overall happiness and relationship. Now, I want to talk about some practical steps you can take if you recognize yourself in what I've been describing. If you've stopped all sexual activity and are experiencing some of the issues we've discussed, don't despair. There are things you can do. First, consider talking to your doctor. If you're uncomfortable discussing this with your regular physician, consider seeing a urologist if you're male, or a gynecologist who specializes in sexual health if you're female. There are also sex therapists who specialize in working with older adults. Second, consider starting slowly. If you haven't been sexually active in a long time, don't expect everything to work perfectly right away. Be patient with yourself and consider it a process of rediscovering your sexuality. Third, don't let embarrassment or shame prevent you from seeking help. Sexual health is health, period. You wouldn't be embarrassed to seek help for high blood pressure or diabetes, and sexual health is just as important. Fourth, consider lifestyle factors. Regular exercise, a healthy diet, stress management, and good sleep can all impact sexual function. Sometimes addressing these areas can make a significant difference. Finally, remember that sexual activity doesn't have to look the same as it did when you were younger. As we age, intimacy might become more about quality than quantity, more about emotional connection than physical performance. The goal is maintaining a level of sexual activity that contributes to your overall health and well-being. Before we wrap up, I want to address one more important point. If you're in a relationship, communication with your partner is crucial. Many couples stop being intimate not because they don't want to be, but because they're afraid of disappointing each other or don't know how to navigate the changes that come with aging. Often, simply talking openly about these concerns can be the first step toward finding solutions. And remember, intimacy isn't just about intercourse. There are many ways to be intimate and maintain sexual connection that don't require perfect physical function. The key is being open to exploring what works for you and your situation. So let me recap the key points from today's discussion. Stopping all sexual activity as you age can lead to physical changes like tissue atrophy, hormonal imbalances that affect mood and immune function, and psychological effects including increased depression and anxiety. However, maintaining some level of sexual activity, even if it's just occasional masturbation, can help prevent these issues and contribute to overall health and longevity. The most important message I want you to take away is that sexual health is an important part of overall health at any age. Don't let shame, embarrassment, or the myth that older adults don't need or want sex prevent you from maintaining this important aspect of your well-being. If you found this information helpful, please give this video a thumbs up. It really helps other people find this content. And remember, I asked earlier for you to comment where you're from, so please don't forget to do that. I love seeing our global community, and it helps me understand who I'm creating content for. If you haven't subscribed yet, what are you waiting for? We're building an amazing community of people who want honest, science-based health information that can genuinely improve their lives. Hit that subscribe button and ring the notification bell so you never miss new content. And finally, if you know someone who might benefit from hearing this information, please share this video with them. Sometimes we need to be the ones to start these important conversations with the people we care about. Thanks for watching, and I'll see you in the next video where we'll be diving into another health topic that affects millions but rarely gets discussed openly. Until then, take care of yourselves and remember, your health and well-being matter at every age.